Well, the only surgeons who don't have complications are those who don't operate. Yeah? And it's very useful to gather experience from colleagues who've come across lots of different complications and developed ways for managing the complication and also helping their patient through it. The title of the workshop I'm involved with this year at the ICS is the management of the complications of pelvic floor and incontinence surgery, demonstration through surgical videos. There's a faculty of 4 consultants, and we're going to demonstrate through 2 videos each some significant complications that we can all encounter as a result of the surgeries we perform for incontinence and pelvic floor reconstruction, and how to deal with them. The key takeaways are an algorithm for how to diagnose complications, how to forewarn patients as well about potential complications, how to diagnose them, how to manage them acutely, including psychological support, and how to manage them surgically. Well, we're hoping that we're going to have urologists and gynaecologists who operate there, but also members of their team who look after their patients when they have smooth journeys and complicated journeys, and so that everyone can spot complications, know what to do next, and also know how to treat the complications, especially if they require surgery. And I think it's massively useful for everyone who operates in this field to know how to take care of patients with complications. It's truly unique because it involves the collaboration of urology, gynaecology, care of the elderly, psychology, physiotherapists, continence nurses, clinical scientists, all the people who are involved in looking after our patients all meet together and can cross-fertilise ideas, and it's a really nice environment.